Time is running out for Braden Lee. His family have less than 2 months to raise £250,000 to get him treatment in America that they hope will save his life. Treatment they can't get here in the UK.
It's just too much pressure. I mean, we have to be at hospital with Braden and look after him when he's really ill, and we have to worry about whether the money's coming in quick enough and whether people are giving us any money at all. Just too much pressure.
They are one of about 100 families every year here in the UK told their child has neuroblastoma, an aggressive form of childhood cancer with a poor survival rate. Treatments here in the UK are limited, and many families believe America is the best option. The treatment offered in the USA, called immunotherapy, involves giving patients 3 drugs. It's been shown to cut deaths by 25%. But the UK won't offer all 3 drugs because they're worried about the side effects. Instead, they're doing their own trials, testing whether 2 or just 1 of the drugs have the same effect.
Whoa, you got him.
But with no guarantee that treatment is as effective, many families believe their children are being used as guinea pigs.
It's so easy to say, well, let's just see if this works and let's just see if we can miss that out. But these are children's lives that you're talking about.
Joanna's son Corey was diagnosed in April last year. Desperate to give him the very best chance, they raised the money and took him to America. So far, his scans are clear.
I'd do it again in a heartbeat. However, that doesn't take away how difficult it was. We didn't want to be going begging for money, making a public appeal. But when you've been told that your child has got a high chance of not making it, you've got to get the very best for him, and that was our only option.
But for some families, it's not just the money that's the problem.
Because Charlie has Asperger's syndrome, I personally don't think he'd cope, and I think he'd be close to having a breakdown going over to America for 6 months. So that was predominantly why we're not going to go for it. If the treatment was available here in the UK, our decision may well be different.
Do you feel a bit better today?
Good.
We featured Charlie's story last month. Now his family have decided to try less conventional holistic treatment and try their luck with the UK trial instead.
Going abroad is not easy. Families are often divided. There's a huge financial pressure placed on the families. The fundraising is a massive task. If treatment was available here, families would stay together and more children would survive, we are absolutely sure.
Do you feel like children here are given up on too early?
Yeah, without a doubt they are. If you relapse here, there's very little that they do. You're sent home with a Macmillan nurse and it's palliative care time. But, you know, go to America and there's hope there.
With other European governments paying for their children to have treatment in the US, families back here feel let down. The charities say it's now time for the government to change tack.
If it was your child, you want your child to have access to the best possible course of treatment. So yes, it's 25% more effective and we want access to it.
It's very important. I mean, it depends on Braden's life. We need this money. He needs all the drugs he can get to help him.
Braden's future now depends on how much his family can raise. His life potentially hangs on the generosity of others. Mel Barham, Granada Reports.